Hello and welcome to another edition of For the Record. I'm Sean Murphy. My guest today for the first segment is a friend who is returning to the show. His name is Patrick McCormick, Director of Uncas Health Districts. So first of all, I say welcome back, sir.
Thank you.
Well, it's been a while since you've been back, at least a year, right?
I think so. I was trying to remember the last time I was here, and we've added 2 towns in the last year or so, so I was trying to remember, was it before or after?
Well, let me ask you, we'll ask the first question for those who aren't familiar with it. What is the Uncas Health Districts?
Right, so the Uncas Health District serves as the local health department for 9 communities now in eastern Connecticut. We serve Norwich and Montville since 1988. In 2007, we added the towns of Sprague and Basra. In 2010, we added Griswold, Lisbon, and Voluntown. And then in 14, we added Salem, and in 15, we added the town of Lebanon. Wow. So we've expanded quite a bit.
Yeah, you have. Now, that's like pretty much eastern Connecticut almost, right?
Yeah, so we consider ourselves the northern tier of New London County.
Okay.
So, and our friends at Ledgelight Health District primarily handle the southern tier.
So what determines when you add areas, towns? Is it just a decision that you make? You feel like it's just advantageous for you to serve these new communities? How does it work?
Yeah, well, I'd like to think it certainly is advantageous for the communities. We like to think we offer a great product for a reasonable price, but certainly a lot of the communities that join us are coming in where they've spent relatively little to any money to provide that public health service. So I admit the fact that usually they see some level of an increase. But what they're getting is a 24/7 service, and they're getting all the staff that we have, including that public health nursing, environmental health, the public health preparedness, and they get a 24/7 response when there's an emergency. So it's quite a bit different. They're getting weekly service versus maybe that couple hours in a certain day of the week that they usually will see somebody. So I think we'll start to see that there's a greater level of opportunity for people to get inspections done. We get a lot more phone calls. We've had those comments in the past where we never had an issue until you came to town. And I said,
isn't that a good thing though?
Yeah, well, I said people didn't know who to call before we came to town. So I think that's where we start seeing that interest. The towns join of their own free will.
I was going to ask you how that, do they approach you or how does it work?
Yeah, it's an interesting process. I think I've been with the district for 11 years now, and there's some towns I probably talked to 11 times. Sometimes that factor will be an emergency that happened that maybe they didn't get the response they wanted. Maybe it's a champion in the community who really sees the need for additional public health services. It may be a communication with the schools or another business in town that they thought went well, and they said, let's look into it more. So I don't mind going out doing the presentation. I think it's great to sell public health in whatever form that they get it. And I also think it's important for the residents to know what's available to them. So once they express an interest, then we talk about how much it would cost, how you go through the process. So usually they have a town meeting or an open public forum to discuss joining the district. They vote on it either at a public hearing or at a council meeting or at a selectmen's meeting, and then they choose to join. They join for a 2-year period. So they're agreeing to join the district, and if at 2 years they decide they don't want to be a part, then they notify us by December of the fiscal year that they're going to leave.
Municipalities usually have budgets, so do they usually have to kind of time it in such a way that they have the funds available to be a part of it, to join it?
Exactly. So they may talk to us a year or 2 in advance when they're really thinking they're going to be interested in joining. They want to make sure the money's available. They want to make sure that the staff who's there knows that they're going to potentially not have a position, or if they want to offer it with our district. So we've used a lot of different opportunities to go out and start getting our foot in the door. Maybe provide advice on a particular issue in town, go out and meet some of the staff in the town or meet with the schools about particular issues. And then our public health preparedness, we actually cover more towns than we serve. So that's been a great avenue for us to be able to introduce ourselves to people in the towns without actually providing the services.
Do you, every time you add new areas, do you have to add staff? Is it like that, or how does it work?
Yeah, I mean, that's the fortunate part for us is that we do gain additional staff when we do that. But my board will tell me that there's a time when you're going to reach capacity. We only have so many vehicles, we only have so much space in the office. So what we're starting to look at now is technology, how we can make technology our friend in terms of providing capacity, being more efficient. So maybe if you can get those phone calls that you would generally get in the office when you're out in the field, maybe you can access our public files more readily when you're out in the field. Can we scan documents and send them to people by email? Can we handle requests when we're actually closed? So we use our website quite a bit, which is that www.uncashd.org. And we take comments right on the website. They actually go right to my phone. Phone calls that go to my voicemail at work go right to my phone. People that want documents sent to them in the field, so you may have somebody who's trying to find their septic system, we can email them a map of where their septic system's located. So those days of having to come into our office are almost non-existent.
I think you fall behind if you're not plugged into current technology and actually utilizing it. I think people in general are using it, so you have to be there with them. It's all about networking and everything, right?
Correct, and I think that part of the interesting aspect of public health now is there's talking about health equity. So you want to have the same minimal level of service for everyone. How do you best determine who has that level of service? Well, you start looking at things like mapping, technology to show where services are being provided, where gaps are in services. We never did that in public health before. It's new to us, but I think
it's a good thing, though, right?
Absolutely. I mean, now we can pinpoint where there's problems and try to direct our services in that way. We'd be the first to admit that we're limited in terms of resources. We'll always be limited. We could always use more people and more equipment. But if we can target the work, then we'll obviously be able to provide the best service.
Well, since you mentioned that, I'll veer into a sort of a sore subject, and that is a fact of life is budget cuts, and you're not immune to that fact, and that has occurred with you as well, right?
Right. I mean, we did suffer a cut in the last budget. Fiscal year wasn't great to us, but I think the important part is the majority of the funding we get really comes from the municipalities, and I have to say a lot for the municipalities that we serve. They've dedicated funds to us over the years. They've kept that pretty consistent. They respect the work that we do. But every year I have that same dialogue either with the city manager, the first selectman, the mayor,
Elections
the council.
just happened as we tape this, so
right.
So maybe there might be new people in office now.
Right. So part of it is reaching out to those folks, reminding them what good work we do. We recognize that the people we serve in many cases are those that don't have a voice for themselves. They may not be those who can even get themselves to an election. They may not be those that can speak on behalf of themselves and advocate for their needs. So we have to remind them that our support of those folks, those are still clients in the community, they're still people that have needs, and they're still people we're going to support.
Now, we've had Ledgelight Health District on too. You basically do the same thing, you're just in a different territories, right?
Right. We're very similar, and I think the important part for the public to know is that if you call one of us and you get the wrong one, then we'll refer you to the other one.
You're not like, don't call here and hang up.
Right, absolutely. It's not a competition.
Right.
What I've said to towns and town leaders in the past is that we want to make sure you get high quality public health service. And the reality is, if you get it from them or you get it from us, the important part is that you're getting that service. We'd like you to appreciate the work we do. We'd like to think that the work we do is as good, if not better, than others. But the reality is that we work so closely with the Ledgelight Health District and all of our other health districts that we want to make sure that we steal the good ideas from each other.
Yeah. And that's not a
share
bad
resources.
thing either. Yeah.
And in reality, if the health district's director goes away, in many cases I'm covering for him, he's covering for me. Likewise with some of the other health districts, if there was an emergency in one health district, we would potentially provide services.
So you work together.
Absolutely.
It's not an adversial role, a situation at all.
No, and it never should be.
Yeah.
I mean, I want to enjoy my job too,
Yeah.
and I think I try to have as little difficulty between different agencies as possible because we do need them. And when there's an emergency and all hands are on deck, then we're going to be calling on them for support.
You want to enjoy your job, and you do a great job at it. What I don't want to say what keeps you up, but what are your biggest concerns these days?
I think the biggest concern for me right now is, that unknown of an illness that's coming down the pike. We've seen things like SARS.
Yeah.
We've seen things like West Nile virus. We've seen things like Ebola. We're worried about pandemics. The day-to-day operations we're pretty comfortable with. It's when we have to drop everything to go and focus on that particular emergency that you can't expect. So that's why we drill and we exercise and we plan and we adapt plans. I would say our Ebola plan probably wasn't what we thought it should be before Ebola started because we were focusing on the thing that happened before it.
Didn't the state do like mock tests or drills or something like that for that?
We do drills annually.
Okay.
We do drills quarterly. We exercise our plans on a regular basis. The reality is until it actually happens,
Yeah.
You can't really completely plan for it. But again, it's that adaptability. It's making sure that staff know what their role and responsibility is in an emergency. It's having a plan for it. You know, you hear a lot about COOP planning, which is a continuity of operations. You know, the first thing we have to think about is how do you handle your own situation if you're going to be called to you know, respond to an emergency. Do you have a family plan? Are you actually going to come to work if there's an emergency? What if half of our staff is sick? That's where we start looking at, you know, that regional response, that statewide response, that federal response. If we use all of our resources, we want to be able to call out additional resources.
Now, how concerned are you about the zombie apocalypse? No, I'm kidding.
No, I've been terrified about the zombie apocalypse.
Well, then
That's
you watch
one of
The
those
Walking Dead.
Yeah, I wouldn't quite know how to deal with it if it happened.
We don't even know what the virus is, by the way. How about schools? Parents, are they concerned? Kids are the most vulnerable, I guess, and older people, too.
Yeah, so the exciting part, I guess, from a response perspective is that they've been managing what they call school safety and security plans for the last few years. Obviously, a lot of that came out of the Newtown tragedy. So, you know, the tragedy resulted in some real positive change, I think, in that schools now are becoming more prepared. There's been funding available for them to purchase equipment, supplies, review their plans, see where their needs are, and they've incorporated people like myself, which in the past may not have been incorporated early, to look at the health and safety component of it. I have to sign their plan on an annual basis. If they have to have a signed plan before they can submit for any funding. So there's a real look at school safety, and that's far-reaching, whether it be the health concerns, disease prevention, environmental concerns at schools, and then they think outside the box too. You know, what if something in the community affected the school community, and what if the school was affected by, you know, impacted what's going on in the community? We realize that in some towns the school is the shelter. The school is the spot where everybody looks to for showering, for bathrooms. So those are very important places in the community, and I think they're finally being treated as such.
You know, another thing that's top of people's minds is terror attacks these days, and in fact, maybe in some capacity, a biological form of attack, obviously.
Right. I mean, those, you know, white powder incidents that we used to have and didn't know how to deal with it, now they're ramped up right off the bat. Clearly, when we have any environmental issue, that's one of the things we think about. You know, is it an environmental issue? Is it a physical issue? Did somebody cause that thing to happen? Is it naturally occurring? Is it not naturally occurring? So we spend a lot of time thinking about different scenarios. Again, you can't think of everyone, but you can adapt. And, you know, I think that's where we really have to think. You know, if somebody gets sick from food, in the old days you'd say, well, why did the food cause that illness? Now you say, well, could it have been caused by somebody who really wanted to contaminate the food, cause people to get ill? We never thought that way probably until 10, 15 years ago. So now that's part of our planning, and talking to restaurants and talking to facilities and saying, you know, if this happened, how would you handle it? We talk even down to food service labeling items. You know, this is white and that's white. Well, how do I know what that white is compared to what that white is? Is that one detergent and that one is sugar? So we talk to them about that, because that could become a contamination issue. If they put it into food, how many people could get sick? So, you know, we start with the basics and then you work your way out.
Are people doing a better job these days of immunizing themselves from everything, not just the flu, but in general? Or are they more paranoid now?
You know what? I think people are asking better questions. I think people have appropriate concerns. I never question somebody being concerned about, why are you putting this in my body? Where should I be getting it? Should I have a second opinion? I think the answer to all those things is yes, you should ask those questions. You should get a second opinion if you feel comfortable. You want to make sure that you get your information from the right place. I think that's my concern, is that, you know, very often people, you know, they're going on the web, as we've always, you know, thought. Or
if it's on the web, it must be true.
Right, and if your friend tells you that they read it on the web, then it's got to be true, because they're a reliable source, your friend is, but they may not have gotten it from a reliable source. So, you know, always talking to your physician, talking to somebody in a position like mine, where I can, you know, reference that question. I can go to the people that I think would be able to give you the right answer. And then if I don't give you the answer you're looking for, then go to somebody else that you think can. You know, what I don't want is people to not get the care that they need because of a fear. You know, they need that information, and the healthcare system right now is very confusing for people. There's a lot.
I know we're almost running out of time, but since you brought it up, I do want to ask you about that. If any thoughts on the you know, the healthcare system as it stands right now? As we tape it, we're in an open enrollment period for people's insurance, I guess, right?
Yeah. So you know, we actually helped people to get insured as part of that open enrollment that you talked about. Access Health Connecticut, we've been a partner with Access Health Connecticut trying to get people insured. There's still some confusion. I think we have, certainly more people insured than we ever had before. Clearly our concern is making sure that the providers are available, that the co-pays are reasonable, that people aren't going to lose access by virtue of now, the new change. There's different ways of getting access to care. There's, more outpatient care centers. There's more clinics within pharmacies. There's maybe, more opportunity to go to a minute clinic. Those type of places are appropriate for certain things. What we're trying to do is avoid those unintended visits. We're looking at the system in terms of being proactive, prevention-based. We'd much rather you get a blood pressure screening at your home than end up with high blood pressure and go to the emergency room. We'd rather deal with your no heat issue in your home than have you be cold, get sick, and end up at the emergency room. We're looking at minimizing the risk and hopefully keeping people from having to spend a lot of money for care that they otherwise don't need.
I've got Sue coming on with me in the second segment. What's going to happen to me?
You are going to love Sue. She's
Okay.
going to take care of you, and she's going to give you a flu shot.
Oh, boy. That's a needle, isn't it? Patrick McCormick, Director of the Uncas Health District. As always, pleasure having you on the show.
Yeah, thanks so much for having me.
We will take a short break, and then I will receive the pain. I'm Sean Murphy. This is For the Record. Stay with us. Welcome back to For the Record. I'm Sean Murphy. We are joined by Sue Dubb, public health nurse of the Uncas Health District, and a returning guest to the show as well. Only last year, someone else was the sacrificial lamb for the flu shot,
Yes.
And this year it's me.
It is.
Welcome to the show.
Thank you.
You can
Sean.
be on. Sue listens to me on the radio as well, so you're always welcome on. So thank you for that.
Thank you very much.
So let's get right into it. Let's start with the flu season and flu shots. And every year, there's a lot of advocating to make sure you get the flu shot. And also, people seem to also learn if there's a particular strain or if it's vigilant this year and all that stuff. So let's talk about it.
Sure. Well, we've been very busy at the Uncas Health District getting people vaccinated this year. We've actually done about 450 vaccinations to date, including a rather unique way. We did a drive-through vaccination clinic back on October 24th.
That's very nice.
And it was a test. Patrick, I think, mentioned about we do our regional plans, we do our emergency preparedness plans, and the drive-through clinic was actually a concept that's been out there for a while about how we would deliver vaccine or other medical countermeasures in the event of a pandemic or other type of illness where we had to get a lot of medication out to the public in a hurry. And so we decided that we're going to try this drive-through clinic. Our neighbors to the south, Ledgelight Health District, have they're the pros here in New London County. They've done it 4 times now, and
If it's a good idea, do
absolutely.
it.
And I actually worked at their clinic last year and saw how well it worked, and I thought we should do this. So
You just decide on a location, or how does it work?
We kind of look at a good sort of traffic flow. You want something that you can go in and out and not have to
Right.
do a two-way traffic pattern. Just for safety reasons and for smooth flow of the clinic. And so 3 Rivers Community College was very gracious in allowing us to use their site, and it worked out extremely well. We were a little disappointed with the turnout. We had about 35 people that came through.
Is it key to get the word out ahead of time?
It is, and we thought we did a pretty good job of that, but I think when anything is new, people are a little shy.
I'll wait till next year to do it.
The good news is that every single person on exit had nothing but great things to say, and they absolutely said that they would come back next year and tell their friends. So.
Yeah. If you can get out there, if you can make life more convenient and easier for people in general, and like you said, it was sort of a test just in case you had a pandemic situation,
Sure.
you'd be able to get out and do it.
Well, the other thing was because it was a drill, we had funding available to purchase the vaccine, so the vaccine was actually free for anyone who came to the clinic, and we were really trying to target people that were uninsured or underinsured, people perhaps with mobility issues that it's difficult for them to get in and out of their car, in and out of the doctor's office. So they just get in their car, they roll up their sleeve, fill out some paperwork, and they get their shot.
You know, it's interesting. You would think that more people would have turned out considering that it was free, right?
Yeah, yeah.
Well, but it didn't happen.
It
Next year,
didn't.
going to do it again next year?
I'm hoping.
So tell me about this flu season. Is there anything that stands out about this flu season in general?
Well, the good news is that you remember last year there were a lot of discussions about the fact that the vaccine was not a great match, and
Right.
it wasn't because of anything in the manufacturing process. Viruses are viruses, and they do what they do.
They mutate?
They mutate.
Right.
And so what happened last year is you had a flu strain that was selected by a committee that selects the flu vaccine strains every year, and at the time, it was a great match. But between the time that they began manufacturing the vaccine, about a couple months in, the virus mutated. And so it was not a good match. And it was too late to begin manufacturing another batch of vaccine because it takes about 6 months to manufacture it.
Are you at the same situation this year where you don't know, you won't know until a little bit later on if this vaccine this year is a good match?
Well,
or?
that happens every year.
Okay.
The good news is that the mutation that occurred last year, that particular strain is in this year's vaccine. And for the quadrivalent vaccines, the second B strain that's added in is actually a really good match to the B strain that's circulating in the southern hemisphere.
I think every year we have to sort of dispel the concern of people that the flu shot doesn't cause bad things to happen to you, right?
Exactly. In the case of the flu shot itself, it's an inactivated virus. So you can't get something from a dead virus.
Right.
I think the confusion comes when people get sick very close to getting their flu shot or shortly thereafter. They don't understand that it takes 10 to 14 days for the vaccine to become fully effective. And so if you are exposed to somebody in that early period after just having gotten your vaccine, you could potentially still catch the flu because the vaccine hasn't had an opportunity to catch up yet. And the thing that makes it even more difficult is if somebody has the flu, they can have it for up to 48 hours before they start to show symptoms, yet they're still contagious. So you could be in contact with somebody at a grocery store or a gas station and not even realize you've been exposed.
You know, I never used to get the flu shot, not because I was concerned about anything, I just never really got around to it. In the past couple of years, I got a flu shot, and you know what happened? Nothing. Nothing bad happens after getting the flu shot.
Right.
So I'm all about it now.
You know, it is fair to say that it is not unexpected to have a little bit of soreness at the injection site, a little bit of redness, maybe a little bit of swelling, but it's very minor, and it's usually gone in a day or so, and it's much better to go through that than to be out for a week with the flu.
Although you wouldn't know it by my reaction when I get my flu shot. But we're almost out of time, so I just want to touch briefly on things like self-management and prevention and things like that, because I know that you want to get to that.
Yeah, absolutely. You know, as Patrick alluded to, we see a very high usage of our emergency rooms for things that typically should be reserved for real acute emergencies, heart attacks, car accidents, things like that. People with chronic illnesses really should be in the habit of being in a good relationship with their primary care physician and managing that disease on a regular basis so that they have very few of those acute episodes where they have a really bad asthma attack. Asthmatics in particular, because it's a breathing difficulty, obviously when you can't breathe, you want to get to an emergency room. However, if you have a good primary care physician, a good pediatrician, they're going to give you what's called a sick plan and a well plan. These are how you take your medications and what you do when you're feeling well. When you're starting to feel ill, these are how you take your medications, and it may be that you change the type of medication that you take, but there's a plan in place. If after all of that it's not working and you have a problem, then it's appropriate to go to the emergency room.
Sue Dubb is going to stab me with a needle when we come back, flu shots. So we'll take one more short break and come right back. I'm Sean Murphy. This is For the Record. So we are just about to wrap up our show for today, but first Sue is going to give me a flu shots. Now, you said it takes maybe a couple of weeks at most for this to actually get into the system. So if I already have something, then this flu shot isn't going to prevent that.
Correct.
Right. So people should understand that it is possible to get sick if the timing is a little off when you get your flu shot, right?
Right.
All right. So it could be the first time that I actually cry on camera. But,
I use a very tiny needle,
Okay,
Sean.
sure.
Okay,
That's
so
what
the
they all
first
say.
thing I did was sanitize my hands just before we went on the air, because hand hygiene is very important. So we're just going to use a little bit of alcohol to kind of clean your arm a little before we do your injection. And just so I'm the nice nurse and you know it doesn't sting, I'm going to dry that a little bit.
That's what they all say.
All right. And this is the Fluceldax. I'm shaking it up a little bit because that's what the manufacturer says we should do. And it's going to be 1, 2, 3. And
I'm in awful
done.
pain right now. No, I'm not. I'm kidding. So that's it.
Let's give you a Band-Aid.
All right. Lollipop or anything? Or that's for the. That's when you go
No.
visit the doctor's office.
We try not to promote too much
Yeah.
candy in public health. So
Yeah. The dentist will like you though.
exactly.
So that's it, right?
That's it. You
Now-
are protected
now,
for
is
the
there anything-
2015 season.
Is there anything that I can't do for a little while? Like, can I be physically active, or none of that
Absolutely.
other stuff matters? It's not like giving blood or something where you
Right,
need to
and
rest
as a matter
after.
of fact, you may actually benefit from moving your arm around a little bit so that vaccine's not sitting all in one spot in your
And
muscle.
I got the stress ball too, right?
Yes,
There wasn't
yeah.
a lot of stress involved in this. So
Yeah.
that is it. Sue Dubb, public health nurse for Uncas Health District. We learned a lot today, and thank you for being on the show and listening to me on the radio and giving me a flu shot. Appreciate it.
You're welcome.
You can see this show and many others on our YouTube site. Until next time, I'm Sean Murphy. Take care.